Specimen assessing. Tissue specimens received in surgical pathology laboratory have a request from the lists and patient information and the history, along with the description of the sites of origin. The specimen are assessed by giving them a number that will identify the each specimen of each patient. Information which must be provided: patient identification of individual requesting examinations, procedure date, adaptive clinical history and physiological examination, organs respects or biases, orientation if required, introspective finding, period surgery and pathologist diagnosis, period treatments, mention if rapid diagnosis is required, gross examination. Gross examination: the arrival of the lab tissue as microscopically examined by the pathologist or pathology assistant is a processing referred to as grossing. Gross's examination consists of describing the specimen and cutting, placing all parts of the into a small plastic cassette hold with hold the tissue will it is being processed to a paraffin blocks. Initially, casts are placed in fixative grossing. Tissue must be applied in lab in a fixatives. Grossing in art. A knowledge of that needs be taken from microscopic study is cervical from a final diagnosis. Gross examination inking. When a malignancy is suspected, that specimen is often covered with ink in order to mark the margins of the specimens. Different colored ink can be used in identify different area if needed. When sections are made of the process, the ink will be marked at the actual margin of the slide. General principles of grossing. Specimen identification: identify all the anatomical structure present. Orientations markers should be identified. The measurements, then length, breadth, height, weight. Examine the external surface. Cut all the organ interval of them thickness. Describe cut surface. Identify pathologist process. If a suspected lesion is present, measure, describe with the color, consistency, surgical margin.